my name is Sean Buchanan. I am the CEO and co-founder of Visom Technology. Healthcare has a problem. It's not getting the information it needs at the right time and in the right way. We know this because medical error is considered the third leading cause of death in the United States. This is one of the problems that Visom is solving for. And what's amazing about this is our timing. Because we've reached an inflection point between hardware and software where for the first time we can put a computer with eyes on the head of a surgeon. We can then understand everything they see, what their decision making is, how we support that, and what and how we automate. What's been missing until this point is that valuable visual data that helps us make sense of everything else. This is the future of surgery. And Visom Technology is the solution. We provide mobile, immersive surgical platform that both captures and integrates both real-time and historical data that's personalized for everyone. It's unique to each member of the surgical team, and it's customized to the patient. The value of this, because not every surgeon is created equal, is we democratize patient outcomes in a better, faster, more valuable way. This replaces a very manual, static patient setup process for a navigation device. This is like a GPS for the surgeon. This process and setup should only take 2 minutes, but it averages 8.5 or over. Because if the patient is even bumped a millimeter, the surgeon has to troubleshoot. Now, you can imagine being a surgeon of how confident you would be utilizing a device like this to navigate your surgery. This device is legacy, expensive, incumbent device that is not only takes up a lot of real estate in the operating room, but it's also anchored there. Meaning, if the surgeon needs to utilize a navigation device patient bedside, it's not an option. We automate all of this by providing the first mobile automatic X-ray vision that recognizes the patient in under a minute with millimeter precision accuracy and integrates right into the surgeon's workflow. We're not recreating the wheel so we can get to market quick with this. We clear through the FDA to revenue with pre-surgical planning in Q1 of next year, and that's conservative. And we then move into interoperative with the HoloLens 2 by the end of that year. And from there, our opportunity is massive. We can move this from 20% to 100% of surgery, create the gold standard of visualization or training, become the first open, extensible surgical platform that integrates everything. As a result, the market is explosive. It doubles in 4 years, killing and creating numerous different categories. And we know that surgeons want this. Our MVP is already creating raving fans. Our survey returns 100% interest in fast automatic registration, which is what we have been concentrating on since day one. This is why we have received a patent for this last month. This is our tip of the spear, which we will take our first mover advantage in to a go-to-market we're already validating. We will be focusing on MD champions at key institutions. We've already started establishing a strategic partnership with the head of neurosurgery at Overlake Hospital in our backyard in Seattle, Washington. We've engaged with 5 letters of intent with surgeons who want to use this right now, including at the Mayo Clinic. And as we build awareness for our device and the efficacy and the tech advantage of it, we'll kickstart that with a validation study where we've already been approved with 200 live patients at the Medical Universities of South Carolina. And we have a value proposition that buyers love. we reduce dollars spent per patient outcome. And this accentuates into a revenue model that focuses on 20 hospitals in the first 2 years and dynamically increases as we move this into different areas of the body and increase our features. This is the team to revolutionize surgery. Most companies either have a visionary surgeon or a visionary engineer. We're really excited because we have both. You combine this with our best-in-class network, shout out to NextCube, as well as our proven ability to create a lot of value with very little, and we're here to jump the crowd. And this here is our acceleration moment. It's where we turn our gated momentum into velocity. We are closing a pre-seed raise of $750,000 with 40% secured on a $5 million cap on a safe note. The use of proceeds will go to capitalizing on the demand that we've barely scratched, ramping our engineering capacity to support all those users, and executing a timeline with immediate events that significantly increase the valuation of our company. This includes being live at 2 different hospital systems. As a result, our software will be used with over 25 different patients, and the data that we are collecting today will be applied to the FDA with the relationship we established in January and guided by a former COO of the FDA. We are looking for partners to build the future of surgery. We would love to connect with bold investors, innovative surgeons, and key hospital administrator contacts so that together we can catalyze the path to surgery without compromise. I really appreciate your attention and your time. If you have any questions, please reach out on email or find us after. Thank you so much.